Assalamualaikum and good morning to all my friends and teachers. My name is Inta Firas Aisyah binti Shahrizal.
Selamat sejahtera, I am Khoi Ji Hao.
Good morning and salam sejahtera. My name is Taija He.
Hi and Assalamualaikum. My name is Muhammad Iqbal Hakim binti Free.
And today we are going to discuss some questions about bone scaffold. The answer for question 1 is the biological response that lead to encapsulation of the HA granules react as a foreign material accompanied by chronic inflammation. The immune system recognizes the material as a foreign material that will trigger inflammatory response, such as macrophage accumulate around the material attempting to isolate or remove it. The inflammation of fibrous capsule will happen over time as fibroblasts were activated and begin to deposit fibrous connective tissue around the hydroxyapatite granules. The persistent inflammation suggests that the HA is not integrated into the bone. The trigger continuity of immune response leading to the ongoing release of inflammatory mediators that hinder tissues regeneration and bone formation. The poor integration of the HA granules could be due to several factors, such as their surface properties is not being bioactive enough, the lack of porosity needed for cell infiltration, or potential contamination during the fabrication or implantation process. As a result, the wound did not heal properly and the HA remained surrounded by fibrous tissue rather than being incorporated into the bone.
I'm going to talk about the approaches to overcome the problem facing on this implantation. The first approaches are surface modification with TiO2. It can enhance biocompatibility and bond bonding. This approach can increase the hydrophilicity, which will lead to a better protein absorption and cell spreading. Thus, it will reduce immune response and fiber encapsulation. Besides, optimization of granule properties is also one of the approaches. By modifying porosity and particle size, the tissue ingrowth will be supported. This method can be improved by using composite such as HA mixed with beta-TCP, which will lead to a faster resorption and bone growth, or also HA mixed with collagen, which will increase the flexibility and vascularization. The third approaches are incorporation of bioactive molecules. Since the rabbit is facing inflammatory environment and poor healing, adding VEGF and PDGF will stimulate blood vessel formation, whereas using BMP will promote osteoblast differentiation and bone regeneration.
So for the question 3 is evaluation of hydroxyapatite granular as a bone graft. So what is hydroxyapatite? Hydroxyapatite is a calcium phosphate material which is the main component of the bone and frequently used in dental and orthopedic because its biocompatibility and ability to promote bone growth. So the risk management approach of this test is performed as a part risk management in conformity with ISO 10993/1. So it performed biological risk assessment to determine which tests are necessary and prepare biological evaluation plan. Next is device categorization, which is the categorized is hydroxyapatite granular, and the class is permanent implant in our bones. With the body contact, of course, our bones. The duration of this implant is more than 30 days. Next, we go through the test and evaluation based on ISO 10993/1. So the first test is chemical characterization, which is the function to identify extractable and leachable component. The second one is irritation or intracutaneous to check for a local tissue reaction. The third one is cytotoxicity to check for acute cellular toxicity. And the fourth one is sensitization to assess potential for allergic reaction. The fifth one is genotoxicity to determine if material may damage the DNA. Systemic toxicity is to assess for a harmful effect upon absorption. And the last one is other tests such as hemocompatibility, which is if there is a direct blood contact between blood and our bone.
And this is the last question. As a biomedical engineering, I will replace the hydroxyapatite granular with composite of beta-tricalcium phosphate, which is a bioresorbable ceramic, and hydroxyapatite, which is a bioactive ceramic. The properties that need to be considered for this new material are chemical, morphological, and mechanical properties. For chemical property, we need to consider the biocompatibility that make the material non-toxicity, pH stability to surrounding cells, and able to support normal cellular activity. Bioactivity, which promote osteoconductive, osteoinduction, and the formation of new bone. Bioresorbability as well as biodegradability. Good bioresorbability and in-control degradation make the material degrade at a controlled resorption rate and creating space for the new bone tissue to grow. For morphological property, we need to include the material porosity, which is 16 to 18 interconnected, and a pore size with at least 100 micrometer in diameter for infiltration and vascularization to promote nutrients and oxygen transportation, and the fully interconnected network of material can prevent fibrous encapsulation and guide bone growth. For mechanical property, we need to consider the Young modulus, which is between 10 to 100 megapascal, and the compressive strength, which is between 2 to 20 megapascal, to match the calvaria bone of rabbit, and leads to mechanical stability and deformation compatibility. Elastic modulus, which tunable to match calvaria bone to reduce bone shielding. Last but not least, this is the references of our case study. And that's all from our group. Thank you.